talking about the statistics of poisoning. Actually, my lot of the data already presented. You know about this, and most of the slides that I am going to use already you have seen. And regarding the history of Poison Center establishment and establishment of National Poison Information Center in Sri Lanka, and what are the functions of the Poison Center? How Poison Center functions help to mitigate poisoning incidents and health benefit and economic benefit of a Poison Center. You know, poisoning is a very common problem in Sri Lanka as well as in the world. In 2016, it is estimated that more than 100,000 people died due to poisoning, and it resulted loss of 6.3 million healthy lives. In addition to that, this is poisoning. The snake bites also causing more death in the world. You can see our figures later. And about Professor Gauramman said approximately about 30% of global deaths due to the suicidal death is due to pesticide poisoning. And this poisoning is one of the major cause for the emergency admission to the hospital. You may like to see what are the figures in Sri Lanka. You have seen global figures. In Sri Lanka, you can see in the early 2000s, we had about 50,000 poison cases per year. Gradually, it has gone up. But by 2019, it is 81,000, 30,000 rise. It is rising. After this pandemic, you can see a slight drop. But our prediction is for future, again it will rise. And this is a huge problem in Sri Lanka. In addition to that, you can see how many patients get admitted to the government hospital following the snake bites. About 35,000 per annum. But fortunately, we don't have much deaths compared to the other countries in the region. You all are doing very well, and because of that, we were able to keep our death rate around 1 per 1,000 snake bites. When we come to the poisoning, why we should need a poison center in the country? You know, the poisoning has very complex chemical scenario, or the lot of chemicals are involved. Some are God-given one. The plants and the snakes or the other animal causing poison. Those are good. In addition to that, we have the human. As a human, we have created our own one. Those are medicines. Those are medicines and other pesticide agrochemicals and some other industrial chemicals and household chemicals. There are more than 60,000 registered chemicals in the market, and there are more than around 7,000 drugs in the market, and there are a lot of poisonous plants, poisonous animals. That any clinicians can't keep those knowledge in their head, and because of that, we need experts to manage this kind of poison. That's why any country needs a poison center. When we come to the history of the poison center, we have heard about the poison management in the future and what's the current situation. It's always better to have some idea about what has happened in the past, and we'll start from there. Initially, it wasn't the poison center. It was a first clinical treatment unit, which was established in the Denmark in 1949. They saw a lot of poison patients coming, especially they were using the psychoactive substances, and they make a specialized unit. In that unit, they manage the patients. They saw there is remarkable outcome with this unit. Same time, 1949 to 1950, that is after Second World War. Then there was a lot of new chemicals, new drugs coming into market. Then what happened? There were more than 400 children who were dying each year. The medicines they were using, the color and the taste was similar to the candy that we use, and because of that they were using and they were dying. But there were no experts available to manage these patients, and because of that they were dying. And people think that if we had poison center, if we had knowledge, we could have prevented this death. Then you can see this historical image. The man is Louis Dalman. He lived in the USA, Chicago. He is not a doctor. He was a pharmacist. Pharmacists who work in this Luke's Medical Center in Chicago. He had very good knowledge about the hazardous chemical, and because of that, when people get poisons with some poisons, they used to call this person. He was very volunteer, and any time he was ready to answer the call. Not only answering the call, he kept the record of these patients and what kind of products, what kind of symptoms these people are developing. And after a few years of work, then with some other doctors, first poison center established in the Chicago, and he was offered the fellowship in medicine in Chicago Hospital. He is the only pharmacist who got the fellowship in medicine so far. After that, since then, there are several poison centers appeared and started because it shows the effectiveness of the poison center in management of the poisoning patients. And after more than 100 poison centers started in the United States itself. But after that, some centers amalgamate. Now there are 55 poison centers in the USA. And there is American Association of Poison Center. Now they have standardized the management protocol, and they are giving same kind of information and treatment protocol for each and every poison center. Then gradually, other Europe countries, Southeast Asia also started poison centers. What about Sri Lanka? You may like to hear what happened to Sri Lanka. We have seen this slide already. Before 1960, our death rate was less than 5 per 100,000 population. But since 1960, you can see gradual increasement of this suicide rate up to 24 till 1976. In 1977, you all know, we opened our economy. The J.R. Jayawardena's era, we opened our economy. With that, there were a lot of chemicals coming to our Sri Lanka without any regulation. There were a lot of advertising happening. And in addition to that, some farmers were given credit facilities and some other intensive to use this pesticide. With that, with the increased usage of pesticide, what happened? The suicide rate due to pesticide also increased. Then you can see the register of pesticide was appointed. Pesticide Regulatory Committee was appointed in 1979, and we were become one of the first suicide, or the capital of the, as Dr. Garaman said, capital of suicide in the world. That is, and after that, this was a huge outcome. In 1988, the first poison information center in the Southeast Asia was established in 1988. The founder was the Professor Ravi Jayawardena. This is our center, National Poison Information Center. Now we are serving at this center. In addition to that, there is a international policy framework for poison control center. In UN Agenda 21st, it recognized poison center as a priority. That's in 1992. Still, we have doubt whether our country has recognized poison center as a priority or not. No? But it's in UN agenda, it's a priority. Another thing, global chemical management institution, poison centers were included in the global plan of action. In addition to that, nowadays we are practicing this IHR requirements and WHO chemical roadmap. According to that, it's mandate country to have poison information center and access to toxicological services. Unfortunately, our toxicological service in our country is not up to the expected level. We are trying to build up. Then how this poison information center function? Usually, traditionally, almost all poison information center provide information through the telephones. We provide 24/7 service to the country. Usually, we get calls from the health professionals, other professionals, police, schools, and public. Then we inquire about the patient's condition and we give individualized management protocol for each patient. You can see what kind of calls we get. This is about 2 weeks ago we got a call from a mother. She was very worried about. She was a lactating mother. She had a 9-month-old baby. And she has taken some cough syrup for her cough. And later she found it's contraindicated in lactating. Then she called us and asked, what will happen to my baby? Should I admit that baby to the hospital? Can I continue my breastfeeding? If not, for how long? Actually, we looked at what are the components of this cough syrup. It wasn't very harmful, and we reassured her and asked her to stop breastfeeding for 7 months because of considering the half-life of these ingredients. And after that, she didn't get admitted to the hospital. This is another case. That's also the first one. 4-year-old child eating powder, small sachets. This is from Mulathu bacteria. Actually, doctor called to us. Patient came to the hospital. This packet contained iron powder. This small child has taken iron powder. Sometimes this iron powder can cause a problem and iron overdose. Then we advise what to do according to the patient's condition. The third one, this is silica gel. You will see with some peanuts and some other preparation we get. This is non-toxic substance. But after eating this silica gel by 3-year-old child, the patient has come to the hospital. Then we say this is not toxic, and because of that we can send the home. But we didn't do that. The reason was this patient was having cold. After eating this one, patient was aspirated with this silica gel, and because of that, patient needed endoscopy, the bronchoscopy, and removed the silica gel. This is a video from a yes, right. Sometimes doctors, this is from a ETU doctor. Doctors are in dilemma. What kind of poison is this? Actually, this is a Hunt-nose viper, and sometimes they just send the pictures of these snakes, sometimes pictures of this poisonous plant, and ask from the center what is the poison. Then we advise according what to do. Sometimes we see the patients online also to the WhatsApp using that new technology, but we don't have this special big boards so far. We are using available resources. In addition to that, toxicology treatment unit, the toxicology center working as a training unit for the whole category of the medical staff as well as to the general public. We train medical students, the doctors who are currently working, postgraduate students, especially emergency registrars. Regularly we are getting this acute medicine registrars trained from the National Police Information Center. And in addition to that, all three forces who are working in the field, they get regular training from the National Police Information Center and several other categories. In addition to that, our center do research and publish. I'll come to. There are a lot of publications from our National Police Information Center. We saw that initially there were a lot of deaths following this introduction of the pesticide to Sri Lanka. During that time, actually, what Ravi Jayawardena and other colleagues has done a lot of research from the Poison Center. It helped us to diagnose what is causing this death in the country, and it was the WHO class 1, the most toxic class 1 category causing more death, and because of that, we were able to contribute to the nation by saying or by suggesting we have to ban those kind of poison from the country. In addition to that, we conduct our toxicology vigilance, we collect data and surveillance also. Initially, before 2000, you can see the most common type of poison was pesticide poison. In early 2000 also, now it has changed. The now trend is household poisoning is causing more death than the pesticide poisoning, or more cases. Pesticide poisoning remain the third place. Then what kind of inquiries we are getting? Most of the time it may be pharmaceutical, maybe pesticide or other household poisoning. We are keeping data. In addition to that, as a National Poison Center, we conduct a lot of public awareness program for the general public, as well as every year we conduct the Mission Nivan Satya, this poison prevention week. Every year we conduct regularly. In addition to that, we made these posters and these handbills and go and educate people about the particular incident if something is happening, especially during this festival season in the rural area. You know, carbon monoxide poisoning following this barbecue oven usage is happening regularly, and every year we go and educate these hoteliers, and now it has, the incident has reduced. In addition to that, the National Police Information Center provides the guidelines. Earlier, before this guidelines, Sri Lanka didn't have any guidelines, and this Poison Center initiate this process, and most of the time they couldn't. Initial period, at maybe beginning of your career, but most of the time we didn't have even this internet facilities, how to manage these patients, and it wasn't uniform. Now in Sri Lanka, you can see everyone is using this national guideline. For national guideline, we are contributing a lot. What kind of poisons currently available, and what are the available up-to-date management. We have access to the Workspace UK, and because of that, we can do up-to-date management for our patients. In addition to that, we coordinate for the antidotes and antivenom supply. We know as a center how much available in Sri Lanka, what is not available, and in which area this is available. If someone has any doubt, they can contact Poison Center and get the information. In addition to that, we attend to the chemical incident events. You can see first picture. This was from the Homa government a few months ago. In the factory storage facility, there was some chemical incident. 3 people died and a lot of people injured. The doctors contact Poison Center, ask about the management. Then we advise. The recent fire incident happened in the Peta, Colombo, this October 27. There were 22 people got injured, inhalation of poisoning, and 1 patient died. Actually, we manage those patients in our wards. In addition to that, this is a kind of chemical incident that's happened in Naramal school. There was a competition over the head position, and one competitor has given poison to other 6. They have mixed poison with the water and asked them to drink. She also has done a little bit, but they all got the vomiting and the other symptoms and admitted the Naramal Hospital. From there, they contact us and we give advice what to do. Already this slide you have seen. Earlier there were a lot of poison cases happening in Sri Lanka, but with the implementation this regulation, pesticide regulation, for that also Poison Center contributed a lot. They find what kind of poison causing more death during this 88 to 89 period, and they suggested what kind of poisons, especially this pentyl and malathion, right? Methyl parathion causing more death. Then in 1995, whole WHO class 1 poisons were banned from Sri Lanka. Pesticides were banned. But after that also, this endosulfan, this was WHO class 2 pesticide, it also causing more death. And then this endosulfan was also banned from Sri Lanka. Then actually after that, this SACTAT team came into Sri Lanka and they did a lot of works. During 2008 to 2011 period, they found this paraquat dimethylene pentyl causing more death in Sri Lanka and helped to ban those substances from Sri Lanka. Now, because of that, we were able to reduce the death rate. Now you can see during last 2 decades how as we are doing as a Sri Lanka. Earlier there were more than 2,000 deaths annually. Now it has come to around 450, around 500 deaths, because you all are working very well. In addition to that, there are a lot of benefit to the society. There is reduction of patients and family anxiety, and we help to reduce the emergency department overcrowding. Otherwise, some people who shouldn't get admitted to the hospital will get admitted. Then in addition to that, the burden of the overall medical system, we are helping to reduce it. And there are a lot of other benefits. When we compare the economic advantage of the poisoning, cost and benefit ratio, unfortunately from other countries or the similar countries like us, we don't have studies. But from the developed countries, there are studies what they have shown. The high income countries, every dollar you spend on poisoning help to protect or save $13. That means for $1 now 325 rupees in Sri Lanka. If we spend $325 to the poison prevention activity, you can save 4,500 rupees. In addition to that, there are some studies. It shows Poison Center service cessation increased 3% of the healthcare expenditure, and it will reduce the death rate obviously. And overall, Poison Centers play a critical role in safeguarding public health and safety, contribute to the management, prevention and mitigation of toxicological hazard, thus providing significant health and economic benefit. And also, spending in Poison Centers help to save a lot of money. Thank you very much.